This is Business Decoded podcast with Ronnie Spellman. An informal chats with top business moguls as they share their stories of failure and success in a fun and relaxed way. Get entertained, educated, and unlock the secrets to success.
Welcome to Business Decoded with Ronnie Spellman. I'm excited to have a special guest, Dr. Chris Holstege, who's the Senior Associate Vice President, Student Health and Wellness at the University of Virginia. Dr. Holstege, welcome.
Thank you. Great to be with you.
Now, you're at an amazing university with an amazing history. Tell me about the university before we start about what you do and what you do at the university.
Yeah, the University of Virginia is fantastic. It's my 26th year here. There's a reason why I've stayed at this institution. 12 schools associated with the University of Virginia. All closely aligned, both in space and in really mission. And because of the proximity, there's a lot of interdisciplinary research that goes on, teaching and service. So fantastic faculty, seen as a public Ivy, one of the top public universities in the country. And it's just been a delight to work here in this career.
And now you have amazing alumni. You mentioned top 5 university. It's up there with Berkeley and the UCLA and next to Harvard, I think. Now, UVA might be above Harvard, in fact, but it's a public school. It's a private school, rather.
By my bias, and I do think it is. So, it's a wonderful, wonderful place.
Well, now you have a great healthcare program. Your law school is fantastic, one of the tops in the country. But tell me about what you do and how did you end up at the University of Virginia?
Yeah, I came here in 1999, and I was recruited by then the first chair of the Department of Emergency Medicine, Marcus Martin, to come develop a clinical toxicology program and a division of medical toxicology and build that up to one that was one of the best in the country and really took care of patients and took care of teaching for our institution, research. That was in 1999. We expanded. In 2013, my career took a little change, and that was when I was asked to step into the position of the student health director. And people thought that was kind of an oddity. But not. One of the biggest threats against students at that time was substance use and still continues to be. And we've done a lot to try and expand in that area, too.
So I'd love to talk about the drugs that you just mentioned. You and I had a conversation a few weeks ago, but let's come back to that later. You've been in over 200 publications. You've also served as the interim of student affairs, if I remember correctly.
Yeah, I stepped in as the vice president last year for about 8 months of student affairs with oversight of all of our student population.
So that means that the university trusts you a lot. You've built a good presence there, and even though you're on the medical side, but you're helping across the entire university from a leadership perspective.
Yeah, working closely with all the other schools, and each school is a bit unique in their student population, both undergrad and graduate.
And that's pretty amazing. So let's dig more into what you did before you made the transition to health services. So I presume you conducted a lot of research. What areas did you focus on?
Yeah, focused on emerging threats. As you can imagine, over the last couple of decades, we've seen a plethora of substances entering society. That really escalated in 2009, 2010, when we saw K2, spice, the bath salts enter society, and really trying to get early warning systems in our own local area, but also nationwide of what was coming to society, what can we do to get the information out to the public so that they wouldn't be harmed by it, and also to our politicians so we can legislate and ban these substances when they come in. And that has continued. It has been a dangerous time in society. There's a lot of things coming in. I worry about our youth. And so a lot of work in regards to the epidemiologic of poisoning, as well as testing for new substances.
Yeah, you and I discussed some of the technology that's in place and not in place relative to testing. I'd love to hear more of your thoughts. The program is mostly focused on the business and the evolution. I think a lot of business has spawned from some of your work and the work of the university. But let's walk through that testing piece. And then also the policy piece related to drugs coming in, because you gave me a long list of drugs across the country. I didn't know a lot of those names. It's a long list.
It is. And the problem is, for example, if we're talking about businesses and what needs to be developed, right now in emergency departments across the country, we're still using immunoassays that were developed in the 1980s when you would go find a street corner dealer. Many of the substances coming into society are not going to turn positive on those drug screens, they call them, urine drug screens. There's also a problem for industry. When there's an industrial accident, someone drives a forklift off the loading dock and gets hurt. Are they inebriated with a substance? It's hard to tell if you're using the screens. So you're absolutely right. And I think that's making a challenge for us. It also makes a challenge because we don't always know what is negatively impacting our patients. And that then doesn't inform our politicians to get these substances banned. We need better technology to determine what is exactly in our patients at this time.
So what are your thoughts on the technology? I know we didn't discuss this piece, but you're right. When I worked in the construction industry, if there was an accident on site, the first thing we did is complete a drug test. Both for alcohol and other substance abuses. It was part of the requirement. OSHA has some impact on how that's managed. But what are you seeing? How can a new technology come? How would you frame a new technology? What are your thoughts on it?
Yeah, what we're doing right now at the University of Virginia, we have what's known as Untitled, where we run it through mass spec, where they have a library of substances that can then pick up. It's really the gold standard, and we do that with urine. And some of our forensic cases, child protective services, drug-related sexual assaults, we save blood and then could go back and see what the blood level was of those substances if we find it, and work with CLIA-certified labs that might be able to do further testing. And of some of these really unique substances, there are not many labs in the country who can do this. Now imagine through the Poison Center, we're covering 45 healthcare facilities, many in medically underserved areas. They can't do any of this testing. And so we're pretty blind at what's going on there. So we need better technology, better mass spec, more rapid testing if we're really going to combat this drug problem that we have in the country right now.
Have you reached out to Elon Musk to get help with the new technology?
I wish he would invest better because I certainly need. Yeah. But I will put out there, James Landers in chemistry department, we worked together. He was doing some work with the Department of Defense, and we did a rapid fentanyl test for first responders and published that. And our first responders need this too in the field. So
interesting.
Yeah, so it's using technology that's out there and maybe adapting. And James Landers was good enough to rapidly adapt. We had an internal grant with one of our doctoral students at the University of Virginia that helped to fund it and published on that a couple of years ago. But using technology that may be used, for example, weapons of mass destruction.
Right.
So
now the fentanyl has been in the news a lot because of how much is coming into the U.S. There is a substance that a person can take, if I remember correctly, that can help not reverse the impact of fentanyl poisoning. What are you seeing? Were you involved in that technology?
Now the technology, it's been around for a while. So we have naloxone. Now they have done different ways of administering for the public, such as inhalation through the nose or with injection. A lot of work that still needs to be done there in regards to antidotes and also making sure we don't do harm to the patients. We have a fourth wave of the opioid epidemic emerging right now, and that's where they're taking opioids with stimulants. And when you unmask the opioid, you have very combative patients, and that's why our emergency departments are one of the most violent workplaces in the United States right now. Yeah, it's been pretty challenging in our emergency departments. So there is an antidote. The other problem is some of the new opioids that are coming out are so potent that the antidote doesn't necessarily work well for those. Right. And that's the other challenge that we're going to have.
Right. Now, in our conversation, we discussed the idea of new technology and how business can support new technology. But on the other side of that process is discussing the impact of policy. And a lot of business leaders I've had conversations, they don't recognize how much policy impacts what they do from a business perspective. Walk us through what you mentioned was really insightful, that policy sometimes lags so far behind that it can't keep up with either new technology needs, or new issues like changes in drugs. Walk me through kind of that policy conversation that we had.
Yeah, to give an example, when K2 and Spice, the synthetic cannabinoids, came out in 2009, there was a bit of a leg to find out that there was a problem, that these really should be illegal. They were not illegal at that time. And it was a credible threat to the population. We had a University of Virginia student, for example, who became psychotic after accidentally getting one of these substances, never recovered, which was just detrimental. What we need, and what, for example, the America's Poison Centers is trying to do, working with governmental entities, is to much more quickly get the data from the poison centers, for example, that we have a new emerging substance, see what the clinical effects are, that they're adverse, that this is a credible threat to the U.S. population, then work with state and federal entities to get those banned and make them illegal. And we need to get much faster on this. The poison centers in this country, there's 55 of them. They cover the entire nation. That data is uploaded every 4 minutes to America's Poison Centers that works with the CDC and the FDA, and a very important component to this to get these off the market.
Okay, that's interesting. So if you had any advice to any companies looking to figure out where to go from this drug epidemic piece, what additional insight would you give them? And real quick, with that, can you list some of the drugs that you discussed? You mentioned one when we spoke called hillbilly heroin, and then your list kept growing. Walk us through some of those.
Yeah, and so, again, we need technology that is able to diagnose this quickly in our patients who are coming to the hospitals, so that we can show that there's actually a problem. That way that data gets to our politicians, too.
Right.
Hillbilly heroin that you mentioned is tineptine. I'm glad to say Virginia just banned that substance.
Oh, great.
It's an opioid substance. It's actually a chemical that's a pharmaceutical that acts in depression in some countries as an antidepressant, but in larger doses as an opioid. But there's many others. There's a U class of opioids. There's the nitazines that we recently published about. These are not detected in any of our hospitals because we don't have the technology.
Okay. Interesting. So list some of the other ones that you might do. One of the conversations we had was around cannabis, and not to get into a public policy debate, but in a lot of states it's no longer illegal, even though it's legal at the federal level. And that's creating a bit of a challenge. And when I see these places that incorporate it into food products, it sounds scary to me.
It is, and we've had a problem here in Virginia since it's been decriminalized. And again, not to get into public policy, however, I do think we need to have public policy that these products should not look like candy.
Right.
So I've been pretty vocal in the media, and our data supports it, that young kids, toddlers, are getting into this and getting sick. We've had one death of a 4-year-old in Northern Virginia from it. We've also had kids in the intensive care unit and on life support from it. So it's all about dose. If it looks like candy and a kid eats a whole pack of cannabis-embedded candy, that's not a good thing. Right. And that should be a public policy. We do not want toddlers, just like pharmaceuticals, we don't want them to get into those products.
Right. Now, beyond the drugs, I don't want our users to get too caught up on just that as one element, but you also work across a full spectrum of public health-related items, including sexual abuse and human trafficking. I think there's a correlation between that and drugs, but walk me through what you're seeing in those two additional areas.
Yeah, there is an interaction. Certainly, we know substance use is used with human trafficking, and that's tremendously concerning. We're doing a lot more in healthcare to try to identify human trafficking. In substance use, the addiction, especially when it comes to opioids, heroin, for example, is profound. I continue to be amazed in talking to my patient population. Many of them will do anything to get their hands on it, including, adverse consequences to their body and who they're interacting with. And it's a matter of what do we put into policies? And we really need a lot more in regards to addiction clinics. We need better surveillance. We need to make sure these individuals get help as we look at our public policies.
Right. And when you start to look at your business, and I think this is a good segue, you have a big healthcare operation, the health sciences attached. Walk me through what that looks like. Even though you're part of the university and a government entity, it's a big operation.
It is. And when I first came to the University of Virginia, I had an old-time faculty member, a professor, talk to me and said, look, you're building a division. it's a business within a department, within a school, within a university. And so it's quite a business working at the universities, getting lots of rewards with it because of the multi-collaborative, the students are brilliant, and a lot of opportunities for growth. And then it's partnerships with public and private too. And so lots of opportunities in the toxicology realm in this area, especially with where we're growing right now. As we talked about technology and how we do detections, how we do public health surveillance, how we manage our databases, all these things we've done in a multidisciplinary with private, public, university partnerships. And I think that's where we have a lot of strength in this country.
Now, take us through some of that partnerships. I've been to your health services building. It's impressive. It's probably one of the best facilities I've seen at any university, but talk the user or the listener through what that experience is like.
Yeah, it was a tremendous experience. So in 2013, I got pulled into the student health because of death of one of our students from Mali. And I was asked to look critically what things could be done to help in the student health realm, which is broad. It's medical services, counseling and psychiatric services, our prevention efforts. And I gathered data. I'm very data driven, presented it to our board of visitors, both what I thought was best practice, our fellow universities, what they were doing, our peers. And I had a board member who was the rector at that time take me aside and state, at the University of Virginia, we're not average. We're looking to be best in practice. And actually, I've always appreciated that comment that, look, we want you to look to see what we can do that's best in practice. And I actually came back and suggested, look, not to be average, but to bring us above average, to be best in practice. These are the things that we need to do for our students to mitigate risk, to really exemplify. And that's what you have seen now in the building that we have built. It's a 160,000 square foot facility. It's multi-collaborative, meaning all these services are working together as teams, not as units, for the betterment of the student. And we're doing a lot of surveillance. Most student health centers across this country are service-oriented, not research-oriented. We changed that paradigm. We're actually doing research in the student population to try and determine best practices and how best to allocate resources.
Now, I think you understated the facility. It's a state-of-the-art facility. You talk about best in class. It is beyond best in class.
No, thank you. I appreciate that. We did. We really looked to see what we could do. As you saw, everything from the facility, how it looks, a lot of UV light, touchdown spaces as a destination place for the students. But also we built this during COVID, we put, for example, a large bank of negative pressure rooms in there in case we have another outbreak so we can care for our students, which is pretty cutting edge. How we have done our prevention efforts, having it on the main floor. We have a large team for the Office of Health Promotion and also well-being and an emphasis on that. Our testing center is state-of-the-art for our students. Our medical center pods where they see are all uniform so that a clinician can go in any one of them and be able to work in any of those environments without a problem with efficiencies built in. So we tried to look at the best practices in each one. And no, it came out well. We have a lot of universities visiting us to see, how they might change theirs now, too.
That's incredible. So when I first went to college, I was playing flag football with some of my roommates. And one guy tried to tackle me by pulling my ear off. It requires stitches. And I couldn't get stitches done on campus. I had to go to a local community to get the stitches done. And I still have a mark on my ear just from that experience. And it was just a basic stitching. But your facility is great. You mentioned the well-being. In that facility, you have a great health and wellness program. And I believe you have cooking classes for students as well. So that's next level.
Yeah, so we're doing a lot in regards to integrating the students into the building, because when I first came in, they thought students shouldn't be helping students, and that was wrong. Actually, the students really like having the students working with them. We're getting the pre-health students experience, and so they're doing a lot of work. They're acting as scribes. They're doing research. They're they're greeters. So we really have engaged our student population in regards to our healthcare, and it's very efficient. So they're getting clinical experience. We're getting the benefit of the workforce. And I think that's been a benefit. They've really been insightful, too. We have a student health advisory committee that really helps to guide us. They give us some very good direction, as you know, and your daughter included. Brilliant students who have joined our university and having their input, and some of the research that they're doing. So I mentioned the 12 schools. I've done research with pretty much all the schools and their graduate or undergraduate students. They've had some wonderful ideas on how to do research in regards to the students' health and well-being. And I think the area that really is ripe for research is well-being and how we're looking at well-being. And that has interest not just for the student population, but if you think about it, there's other populations that really are similar to us, the military, for example. I've been in communication with in the past because they have a young population, similar age group, and how do we look at them? Law enforcement's talked to me. And I've even had industries that have talked to me about what we're doing in regards to our well-being programs, and that's where I'm really hoping to expand in the next 10 years.
Can you walk me through more of what you just described with the military from a well-being? That, I think, is exciting. I worked in behavioral health care for quite a few years, in Virginia, in fact. And that well-being piece is taking another center stage. You had Simone Biles, the last Olympics, talk about her well-being and needing to take time off, and other athletes. But walk me through what you're seeing and how you're helping the military from a well-being.
Yeah, if you think about it, our student population is similar demographic as the military. If you think, then, we have, like I think the military has too, we have a lot of alpha personalities. Right. They're hard driving. They don't necessarily take time out. And I don't know about yourself, in my career too, I have found times where you got to sometimes just take some time. If you refresh, you're actually going to be much more efficient and you're going to do a better job. I've been a huge proponent of students getting in the outdoors. As you know, the University of Virginia is often ranked as one of the top outdoor universities for things that are around it. And it's, the Blue Ridge nearby, a lot of hiking trails, just to refresh. And I'm a firm believer in some of our naturalists, such as Thoreau and Muir, who talked about the importance of getting, refreshing and getting outdoors. Right. Music. Yesterday, we have a teaching kitchen, and I actually worked with them yesterday, which was a joy. Nice. So how we look at nutrition, exercise, we're doing functional exercise, and we just launched that program. So how to do exercise appropriately. I don't need my students running marathons, just getting out, walking, doing a little weightlifting, yoga. There's a whole host of things for mental wellness. And I think this is true for everyone, whether it's the military, industries. It's good to get those breaks, to have some time to keep your physical and mental health. And I worry right now in medicine, very quick visits, people who have anxiety, depression, the quick fix is to give medications. I'm a toxicologist too. And I want to be careful on how we give medications to youth in the developing brain. So what can we do to mitigate this mental health crisis that isn't necessarily medicating, but other things? And that's where we get into well-being, and we need more research in that area. And we're hoping to help lead in that area.
Well, that's fascinating. You remind me of a conversation I had with Dr. Kenneth Cooper. I don't know if you studied any of his work. And we've had him on the program as well, but he's all about the aerobics, the well-being. He wrote a lot of the structure on well-being for the military. So it sounds like you're following a similar approach.
Yeah, and I absolutely know his work and others too. And I think it is an evolving area where we're going to see a lot more research and pretty exciting research moving forward. And I think it's of a benefit to society overall. And I do think some countries actually are on top of this too. If you look at some of the Scandinavian countries, for example, they've done a great job in this area also.
And I think Brazil has done a pretty decent job in this area. And he's well regarded, Dr. Cooper, in Brazil.
Yes. Yeah.
Now, from a cost of healthcare perspective, what are you seeing in the marketplaces? I just interviewed a young man who leads an insurance healthcare business, and we had a conversation about it. And how do we look at healthcare from a cost perspective? Yeah,
boy, that's a challenging question overall, right? That is so broad. The student health model is really kind of an intriguing one, isn't it? Because the students pay a set amount for use of all the services that we have, and they pretty much have no wait time for medical or counseling or psychiatric.
See, that's incredible.
Yeah, no, we've got our wait times down to virtually, they can walk in and be seen immediately. Some kids of our students can afford it, other ones who can't get help. And then if they have extreme needs, that's where insurance kicks in. And then we'll refer them to the health system. But the majority of our student population, we're able to provide the services to keep them there and get their care actually at student health and wellness. If they need more advanced care, we can then refer them over to the health system and work with them for advanced care. Now, as you know, there's certainly a tremendous amount of problems. The emergency department wait times are exceedingly long. I don't want my students to go there unless they need to. That means making sure that they have either a call service that they can call 24/7 or telehealth. And we're seeing more of that developed in the country, trying to take some of the pressure off the emergency departments and that exceedingly high cost. I think one of the biggest problems, and this is one I don't have an answer for, is with so many baby boomers and our physicians retiring, our experts in various areas, there's tremendously long wait times and how we're going to mitigate that. And some of that is telehealth. I think telehealth can help to mitigate some of this. I'll be curious to see where that technology goes. Be very curious to see where AI goes too.
Right. Yeah, we began telehealth at my healthcare company about 20-something years ago, and then I've managed the healthcare operations for several companies, and that telehealth keeps growing. I think people are trying to figure out how to better use it. Ironically, when COVID happened and people became more used to virtual calls, I think people started to become more comfortable with having telehealth by their computer.
I agree. And it was interesting with our student population for mental health. For example, we partner with a company to do our telehealth for mental health, which has really broadened the providers that we can use, which is great. So our students have more options for providers. It involves, and it also is across state lines because they're a national company. Right. And that's a huge benefit. The same token, we had students who wanted to see providers in person. So we kept our counselors focused on the in-person for our students while having a telehealth company do the ones who want to do virtual, which I think really helped to broaden capabilities for our students. And you can imagine when crises occur, we're able to flex up more easily because we have a large telehealth company. Right. When the shooting occurred, that was just decimating to our community. A lot of kids needed mental health at that time care. Having that ability to flex up with a company that's virtual was really beneficial for us.
Yeah, absolutely. And I asked about the cost of healthcare because universities can oftentimes be an incubator for innovation, which is why we started in that arena. And I'm amazed when you talk about the little time wait time at the Health Services Center, that could be an opportunity for that knowledge to be extended into the private sector healthcare.
Yeah, and I wish we could. It's interesting, and I'd love to talk more with people about that because I think from a societal standpoint, we're able to cut out so many people in the middle, right? And the students, there's this fee up front, and actually and then they have this kind of unlimited resources they can go to. Now, granted, we have a very healthy population too overall. Right. But I do like the model. And so then it's a question of when insurance kicks in and having the providers. But no, I've really enjoyed the model that we have in the student health centers.
Right. And a lot of people are unfamiliar with the community health program by the federal government, particularly for rural areas. And I suspect that they try to operate similar to yours, but they just don't have that level of efficiency yet and innovation.
Yeah, and I think we're all trying to develop that. And I think, as you mentioned, where does telehealth play a role in this? Where do call centers play a role? Our public really needs someone, especially in today's modern age where you have the internet where people are looking up stuff themselves, which I think is great, but can also have a lot of misinformation. You want legitimate sources that they can go to fairly easily and then take some pressure off the University of Virginia health systems so that they're really managing the more advanced care and complex care. And again, I expect we're going to see just huge developments in this area over the next few decades.
Right. It's been fun watching, and I know we're near the end of our program. It's been fun watching the technology of a Fitbit or the Apple Watch and how it can assess your heart rate. Do you have any insight on that technology and how maybe the university is using an app to help students in health?
No, I think from a well-being standpoint, huge advantages. I don't know how many of you I do. How many steps do you get in a day? Stairs, right? And so I do think it keeps your mind on it. There's some technology that one of our clinicians is doing now that is it's a wearable watch that actually takes the conversation that the clinician has with the patient to make sure it's not too complex. Are you relaying things and information correctly? So I think we're going to see more and more technology that helps guide us as clinicians, how we're communicating with our patients, are we getting the right information out to them? And those are, I think, just phenomenal developments that we're having right now. Again, we alluded to it at the beginning when we were talking, but again, the well-being component is just going to be the thing we have to focus on in our country. Right. Making sure and I think that technology will really help if we can get the public to use it.
Right. Well, Dr. Holstege, it's just been a pleasure talking to you. I'm grateful that you can join us. You're in your first week of school with this college students back, so I know it's been a busy week, but I appreciate you coming on with us.
No, it's been a pleasure talking with you, and I wish you well on everything that you're doing, the good work.
Great. Thanks for joining us on Business Decoded with Ronnie Spellman.
Thank you for listening to Business Decoded podcast with Ronnie Spellman. Please be sure to subscribe and share and stay tuned for more incredible Business Decoded episodes.